kids and parents. Hope you're having fun learning and playing at home. I'm Dr. Prachi JADHAV. I'm an endocrinologist. What is an endocrinologist? Endocrinologist is a doctor who deals with problems like obesity, diabetes, hypertension, thyroid problems, and many more hormone-related problems. So kids, what all activities are you doing at home? I know you cannot go outside to play in the garden, your school is closed, your various sports classes, dance, swimming, karate class, all are closed and we have to be at home to be safe. What I mean to say that your physical activity has decreased, it has become less, and you must be spending more time watching TV, mobile, video games. So kids, have you checked your weight? How many of you have gained weight? किस-किसका वजन बढ़ गया है? I'm sure most of you must have gained weight. So that is why today I want to discuss with you and your parents regarding the increasing risk of childhood obesity and thus the importance of good health, good eating habits and daily physical exercise. So parents, you must be wondering, can children be also obese? Yes, definitely. Children can also be obese, not just adults. Obesity means having extra body fat and thus having more weight that is required for their age and for their height. Obesity is not just a problem in adults but in kids too, and it's rising very rapidly in our society, and that's why I want to make you aware and more sensitive regarding this childhood obesity problem. Your next question must be, Doctor, how do I know that my child is obese or not? So dear parents, checking your child's weight regularly at home or maybe with your pediatricians and plotting it on the weight charts which are available for both girls and boys, it can give you a fair idea whether your child is having stable weight or whether they are gaining weight rapidly or not. But more accurate method is to look at the BMI of the children. BMI is body mass index. We can calculate it using a formula. Weight in kg divided by the square of height in meters, and it tells us mainly the required weight for the height and for the age of the child. We have BMI charts as well available for both girls and boys, where we can plot the BMI of the child against the age of the child, and thus we can know whether the child falls in the normal range or not. If the BMI is more than 85th percentile for that age, then we call it overweight child, and if the BMI is more than 95th percentile for that age, then the child is having very much high weight and we call it obesity. So you can take your pediatrician's help as well to calculate the BMI of your child. So now you must be wondering whether my child is at risk of obesity or not. So parents, we need to identify two main important factors which can lead to increasing weight in our children. The first one is our family genetics, the family genes. Just like we know tall parents have tall kids, similarly, if there is obesity in family or diabetes in family, in parents or grandparents, then our kids can have more tendency to gain weight, rapid weight gain, and thus they can go into obesity. And the second important factor which is important for rapid weight gain in children is their lifestyle. Like I said, there is a sudden change in our kids' lifestyle. Their daily activities, physical activities have decreased. They are at home all the time. The screen time has increased. Being at home, there is more snacking. The food intake has increased. Overall, what I mean to say is the calories intake, the food intake has increased, and your calories expenditure, that is the calories lost from the body, has become less, it has decreased. So overall, these excess calories, these extra calories get deposited in our body as fat and it results in weight gain. So now I know your next question, Doctor, what if my child is obese? I always thought that a chubby child is a healthy child, but so can this extra weight be harmful for my kid? Definitely yes. If your child is obese, he or she may have more risk of health problems in childhood and also later in life. Health problems like childhood asthma, sleep apnea, exercise intolerance, early puberty, that is early menses in girls, delayed puberty in boys, PCOS in girls, in puberty girls, Bone problems like fractures or maybe bone deformities, all these can occur early in the childhood. Also health problems like high cholesterol, fatty liver, high blood pressure, diabetes, gallstones, all these can occur early in the adult's life. And last but not the least, these obese children can have a lot of psychological disturbances like low self-esteem, negative body image, teasing, bullying from friends, and depression as well. So coming to the final question, Doctor, what can we do to control our child's weight? Surely we need to act now to prevent our children from gaining weight. Prevention is always better than cure. There are 3 important steps towards good health. These are healthy eating habits, good regular exercise and active lifestyle, and behavior modification. Coming to the first one, healthy eating habits. We must promote healthy eating habits right from early childhood. What is a balanced diet? A balanced diet is the one which is rich in fruits, vegetables, rich in fiber, rich in proteins, and have only limited carbohydrates and fats. We must avoid calorie-dense foods, that is, the fast food, the fried food, sweetened juices, sweetened drinks, or maybe soda drinks. Water is the ideal beverage for all ages. For young kids, we must not just try to make food attractive, but it should be healthy as well. Avoid the instant ready packed food items. These are quick and tasty, but they have preservatives and maybe artificial sweeteners which can be harmful to your child's health. Second one is we must promote healthy lifestyle in our kids, because an active child grows up to an active adult. Encourage them to have more physical activities, more physical games, dance, skipping, yoga. All these they can do at home. There are many online classes also which are available to help us train our kids with these. Apart from these, include an exercise regime of 20 to 30 minutes per day in their daily routine will definitely help. Behavior modification, it is a very important step towards good health, and for not just children but for the whole family. Eating meals together as a family with TV, mobile off at meal times, limiting the fast food intake of the whole family to less than once a week, drinking more water, exercising together, it can be fun and definitely improve the health of the whole family. Limiting the screen time to less than 1 hour per day, that is watching TV, mobile, computer, all less than 1 hour per day should be done. Setting a bedtime routine and having a good sleep, sound sleep of 10 to 11 hours per day for children is very important. So these behavior modifications will help the whole family in the long run and help them build a good health in future. So dear kids and parents, hope you are now more aware and sensitive towards this rising problem of childhood obesity. So be wise, eat right and exercise. To extra weight, say goodbye, and today check your BMI. Thank you.